In intravaginal culture, fertilization is made to take place in a vial kept in the vagina as incubator. In natural cycle IVF, superovulation is avoided and a single egg of the natural cycle is used for fertilization. In vitro maturation, immature eggs are collected during the natural cycle. Then, they are matured in vitro by adding special chemicals to culture media. Thus, many eggs are available for embryo formation without using injections for superovulation. In transport IVF, retrieved eggs are transferred to the central IVF lab for in vitro fertilization. Since success means having a baby, it takes a lot of effort to achieve this. For this purpose, IVF treatment should not be considered to be a single-shot affair. Studies worldwide show that average pregnancy rate per cycle of IVF is about 30% to 40% for most patients. A chance of successful IVF treatment decreases with increasing age over 40 years or so. It also depends on the quality of IVF clinic, its services, and the superovulation regime used. If 3 good quality embryos are transferred, the chance of pregnancy is about 40% in that cycle. If more embryos are transferred, chances of multiple pregnancies increase. It is possible to maximize the chances of success of pregnancy, provided you observe certain restrictions. You should avoid all medications, smoking or alcohol, excess caffeinated beverages, change in dietary pattern, exercise, and hot tubs or saunas. Since IVF involves drug treatment, it involves certain risks and complications. Ovarian hyperstimulation syndrome is the major side effect known. There is lethargy and fatigue due to hormonal stimulation. Abdominal distension, discomfort, and dizziness may occur due to outpouring of estrogen-rich fluid into abdominal cavity. The chances of an ectopic pregnancy and multiple pregnancy also increase in an IVF cycle. There is a psychological risk of failure leading to anger, depression, and resentment. One possible outcome could also be the cancellation of the IVF cycle. One should not get discouraged if one IVF cycle fails. This is because even a failed IVF cycle gives valuable information about how your ovary responded, whether endometrium showed changes favorable for implantation of fertilized ovum, whether fertilization occurred. A failed cycle needs to be carefully analyzed so that the treatment plan can be modified for future cycles. After analyzing a failed cycle, it can be repeated after a month or so. This time gap would help to marshal the emotional strength of a patient. On such repeat occasions, there are many other techniques that can improve the ultimate outcome. Pre-implantation genetic diagnosis by embryo biopsy can be done to ensure that embryo are healthy and without any genetic disease. Co-culture of embryo with feeder cells would provide extra nourishment for better growth. Blastocyst transfer, wherein embryos are grown till blastocyst stage, a stage just before uterine implantation. This is then transferred to uterine cavity. Zygote intrafallopian transfer, wherein fertilized egg before cell division, that is, zygote, is transferred to fallopian tube during laparoscopy. After knowing all the complexities and potentialities of such an advanced technique of IVF, the most important decision an infertile couple needs to make is the selection of an IVF clinic. This would depend on qualification and experience of personnel, types of patients being treated, support services available like ZIFT, sperm donors, ICSI, cryopreservation, emergency consultation, cost of various services and convenience of treatment, record of treatment cycle over the last 2 years, rate of successful pregnancies. During IVF treatment, keeping records is important, especially for review whenever required. Records of IVF treatment include treatment and visit record, reports of USG scan and blood tests, prescriptions and bills of payments, follow-up and hospitalization record. Availability of this record would help to know the progress of the cycle from time to time. Cost of total IVF treatment would depend on IVF program and technologies involved for getting successful outcome of IVF, cost of hormonal treatment involved, cost of ultrasound scans and blood investigations, hospitalization and consultations. Thus, with proper selection of an IVF clinic and using modern technology, you can maximize your chances of achieving a favorable result, so you have peace of mind that you did your best. The IVF Lab can help you in your quest for beginning a new life. We wish you all the best.